Okay, so we had a little bit of a technical difficulty when using my phone for the videos. It started to overheat and stop the video. So I think where I left off was I was just about to start listening to the heart sounds. We're using my mom's phone, so we're gonna start again, okay? So now we'll be listening to the heart sounds. Okay. Switch this around. Okay. Okay. We're first going to listen to here. Okay. That's clear. We're going to listen here. That's clear. This is clear. All right. All right. This is clear, and then the apical or mitral valve is also clear. Okay. So let me document that. Where is it? Okay. Heart sounds are regular. Okay, so now we're going to move on to the respiratory. So now that when I first started the thing, I took her radial pulse, and as I was doing that, I counted her respirations. She didn't seem to have any trouble breathing. Everything was regular. There was no wheezing or trying to clear her lungs or anything. So that was good. Next, I'm going to listen to her lung sounds. Okay, let me switch it back. Okay, Mrs. Murray, would you mind taking a deep breath when I say okay?
Mm-hmm.
Okay. 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 All right, Mrs. Murray, do you mind lifting your breasts up a little bit for me? Okay. 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 Good. All the sounds so far are clear. Okay. Two more. Okay. Okay. Lung sounds are clear. All right. Okay. And they are clear both on the right and left side. All right. Mrs. Murray, now how many times do you think you urinate throughout the day?
About 6.
About 6 times. And are you continent or incontinent?
Continent.
Okay. Good. Next, I'm going to inspect her teeth. Mrs. Murray, do you wear any dentures or partial dentures?
Nope.
Okay, no dentures. Can you smile for me? Right. Very good job on the teeth. Very clean. Let me see if you have any caries. Okay. No caries. Okay. I'm going to pull your lip down just to inspect your gums. Okay. They are in fact moist, intact, and clear. Okay. Intact, moist. Okay. Now I'm going to inspect your abdomen. I don't know if you want to lay down. Okay. All right if I lift up your shirt here?
Yeah, sure.
Okay. Okay. So abdomen. All right. I don't see it distending or any protrusions, so that's okay. All right. I'm going to feel around for it. All right. It is soft. Any of this tender for you at all?
Mm-mm.
All right. So it is soft, non-distended. It is non-tender. Okay. Next, I'm going to palpate. So I'm just going to, like I said, press. And you let me know if at any point you feel any pain. Okay. Okay. Now, oh, I'm sorry. Before the palpating, so you don't move around the intestines, you would auscultate first, so you don't move anything around. So I apologize. I did the palpate first, and then I was going to listen. You should listen and then palpate. So I'm going to redo that, and I'm going to listen to the bowel sounds. I'm sorry. All right, so first we're going to start in the right upper quadrant. Okay. And when you're doing this, if you don't hear any bowel sounds, you would listen for 5 minutes. But as I can clearly hear, you just ate a meal, I'm assuming. All right, now I'm going to do the right lower quadrant. Here's an RFI. Okay. All right. It's actually pretty interesting. All right, now I'm going to do the left upper quadrant. And now I'm going to do the left lower quadrant. Okay, I did hear bowel sounds in all 4 quadrants, so at this time I would then palpate, all right? So you let me know if at any point you feel any tenderness, okay? You okay, Mrs. Murray?
Yeah.
Okay, so I did hear bowel sounds in all quadrants, and I did listen and there weren't any problems. Okay, next, may be a little uncomfortable, but Mrs. Murray, are you continent and incontinent in regards to bowel movements?
Continent.
Okay, you're continent. This is my dog Scout, by the way. My patient's therapy dog. All right, and your last bowel movement, if you can you remember the color, the size, and the consistency?
Today, normal,
Hold on, this is
soft,
Today. Color is normal.
brown,
Brown.
soft,
And the size, what would you say?
average, normal.
Average. Normal. Inconsistent, you said soft. All right, so now I'm going to assess her range of motion. Now, Mrs. Murray, do you mind lifting your arms above your head? Just seeing if you can move your extremities without any assistance. Can you do a flexion and extension of your elbow? Can you do the same with your wrists on both sides? Can you squeeze your hands? All right, may you move your legs freely without any help? All right, can you flex and extend your toes as well as your ankle? Okay, so range of motion is good. All right, now do you have any trouble walking?
No.
All right, you don't use any assistive devices, canes, wheelchairs,
No.
walkers? Okay. On frequent, how far do you walk if you're going for a walk?
A couple miles.
Okay. Do you have a number in mind? Be a little more specific if you could.
2 miles.
2 miles, all right? Just for documentation, thank you.
Mm-hmm.
How often do you do this? Say weekly?
3 times a week.
3 times. All right, and how do you feel before, during, and after the walk?
I feel fine.
Okay,
No pain.
no pain. And do you see any physical therapy or occupational therapy?
No.
Okay, none. Okay. How would you assess yourself for risk for falls? Do you fall a lot or no?
No.
Okay. Do you don't use any bed alarms, rails, or anything to help in the bathroom or whatnot?
No.
Okay. Next, so she has no risk for falls. She doesn't use any assisted devices. Next, I'm gonna check her integumentary system. Okay. So I'm just gonna see her skin, and the best time to do a skin assessment or anything would probably be, as they're either about to take a shower, so you can see like their whole body. But just for this purposes, I'm just going to check the skin. I see that it is all intact. All right, just let me check up here. Let me check your legs. Okay. I see the skin is intact. I don't see any rashes, bruises, scars, or lesions. Okay, it is intact. And I'm going to check her tuger. I'm going to use the clavicle for the site. All right. Okay. Skin tuger, less than a second. And like I said, I checked the clavicle. And as I was just feeling around, her skin is warm and it is dry. There's no tenting. It's not hot. It's not cold. It's not cool. Okay. Next, I'm going to do her psychosocial evaluation. Okay, Mrs. Murray, have you been getting recently more sleep or less sleep?
Regular amount of sleep.
Regular amount of sleep. Okay.
Regular for me.
All right. Do you have difficulty falling asleep?
No.
No difficulty. Okay. Do you have difficulty? You said you have no difficulty falling asleep, but what about staying asleep?
No.
Okay. Do you have difficulty waking up?
No.
And do you have, like, say, during work or during the day, do you have difficulty time staying awake and alert?
No.
Okay. Okay. Do you have any trouble concentrating, like decreased concentration or increased concentration?
No.
Do you have any increase in obsessions or excessive racing thoughts?
No.
Okay. Okay. Do you have recently have you had an increased appetite or decreased appetite?
No change. I'm dieting, so I'm limiting my
Okay.
calories.
Okay. And is your diet going well for you?
It is.
Okay, good. Okay. I want to do your mood. Do you have any increased anxiety, mood swings, fatigue, suicidal thoughts at all?
No.
None of the above?
No. None
Okay.
of the above.
And now we're going to do the spices assessment, and like we already said, she does not have a sleeping disorder. She has no trouble going to sleep, staying to sleep, or waking up. Do you have any problems with eating or feeding yourself?
No.
No problems. And incontinence, you said you are continent. Confusion, do you have any confusion at all by any means? You were alert to all four. Okay. There were no evidence for falls. Okay. And for what I could see, I did not see any skin breakdown. Okay. All right. And then any abnormal findings or anything I feel worthy of reporting, I would write in the nurse's notes. Mrs. Murray, thank you. Whoops. Thank you very much. I'll see you next time. All right.
Thank you.
That is it.